Welcome to PA College of Health Sciences Simulation Labs. I'm going to give you a little virtual tour of our lab and a little bit about what we do here. So my name's Nikolai, and we'll just take a quick look around the lab, all right? All right, welcome to the nurses station. So this is where students get a lot of work done. While a lot of healthcare takes place at the bedside, healthcare providers do a lot that we as patients don't see inside the room. So let's take a quick look around here and see what the things we have that our students will be using. So we try to make this as realistic as possible for the students, and we like to give them real tools to work with. So isolation cart here, there's gowns, gloves, masks, everything you'd need to use to protect yourself and your patients going into a patient's room. There's a real crash cart here. There's an actual LifePak 20, so an EKG machine. So if you need to take a picture of the heart, of its electrical signals, you can use that. Here's a couple of our rooms. So around the nurses station are 4 patient rooms. So these are single bed rooms. This is kind of set up like an ICU. Our nurses station has a fully stocked supply cabinetry. There's everything you might need here for med-surgical nursing. So different kinds of oxygen masks, incentive spirometers, inhalers, flow meters, urinary supplies. So there's actual catheter kits in here. This is a straight catheter kit. Looks like there's also a full catheter bag catheter kit. Some measuring things, because we need to do INO, which means checking the fluid going in and out of people. Sample cups if you need to have urine tested. And there's also bedpans and urinals too for patients that can use the bathroom themselves, because nobody likes to have to use a catheter. There's also bandages. We have all kinds of bandages stocked, so if the students need to do wound care. Here's some more bandages. Sterile water for wound cleaning. Here's some swabs for taking a sample. What else do we have here? Let's see. Tape. Never always can use tape, so maybe you have to apply some bandaging, something like that. More bandaging here. So there's also restraints up here too. So some patients can be confused. Maybe you have dementia or some other kind of mental illness, and they need to be restrained temporarily for their own safety. Maybe they're just, have been put under sedation. So these are finger control gloves. These are safety vests to make sure nobody can fall out of bed. It usually has to do with people falling out of bed. That's a big concern in the hospital. And here we have everything to give IV supplies, give IV pushes, or other things with syringes and needles. So there are flushes. So these are just syringes filled with a little bit of salt water that are used a lot in healthcare. Different kinds of needles. Some of these needles are used for going into a vial of medication. Others are actually going through the skin. Some are a little shorter because they're not going as deep into the skin. We have more syringes of different sizes. And at the bottom we have eensy-peensy little insulin syringes. So these guys are real tiny for delivering just a few units of insulin. So they're very specialized. And there's also IV tubing here too. So people get IV solution hung. So they use these kinds of tubing to run from the bag on the pump all the way down to the person. So we'll take another quick look at that soon. And lastly, we're going to arrive at our medication cart. So the Simulation Labs medication cart is stocked very similar to a real medication cart. Each drawer has alphabetized medication. These aren't real meds in Simlab. We get these through different companies that make demonstration medications. Occasionally, if we have to, we can use candy if we need to. But they're packaged like they are real. So there's an actual barcode that can be read. There is a dosage, and there's a real drug name on everything. It does say demo only, so if these happen to make it outside the lab, nobody gets confused with them. So we have dozens of different kinds of medications. Some are pills. These are some pre-filled syringes with different things. We also have vials. So if you get an IV medication, usually they actually draw it out of a vial into a syringe and then inject you with it. So there can be You can store it in a little larger quantity. So here we have some diphenhydramine, which is Benadryl. And also we just stock general IV fluids. So these are 50 milliliter bags of normal saline being 9% salt in a solution of sterile water. So there's different sizes here, ranging from 50 milliliters all the way up to big 1,000 milliliters on the bottom. We also have some pre-mixed solutions too. So the pharmacy will bring you a bag that they have already put a drug inside of. So this is pretty similar to what you'd really see in the hospital. Here's amiodarone, 150 milligrams in 100 milliliters. So everything's labeled with a strength and how much fluid it's in, so we can calculate how fast this should be running. This guy also has a little IV filter clip to him, because some medications can actually get little chunks of the medication or something like that and need to be filtered. So we clip this on here so the students know that this goes with the filter. It needs to be filtered. So there's smaller bags. And lastly, in medications, we have a little refrigerator, because certain kinds of medications will need refrigerated. Things like insulin or more insulin. Different kinds of insulin, so we stock lots of it. Different antibiotics can be. We have them hung up here. Here's some pre-filled insulin pens. This is probably an antibiotic. Oh, pneumonia vaccine. So a lot of things stored out here, all just so the students can get used to using real equipment.
Nursing and most healthcare professions are very skill-intensive careers. To become a nurse, you must pass many skill checkoffs to prove that you can handle the complex tasks. Students can find this multitasking daunting at times. One of the main reasons simulation is used is so that the student nurses can practice multitasking all these kinds of skills while thinking more broadly about how to properly care for their patients.
So this is one of our larger rooms. As you can see behind me, there's one patient, and behind me there's another one. So this is a two-person room. There are curtains on the sides, so these can be drawn for privacy reasons. If you're here by yourself, you probably don't want a stranger staring at you all day long. But for space constraints, these are pretty common in different parts of the hospital. So there's an entirely different setup for each person. There's a head wall behind us. And he can have IV pumps set up, maybe there'll be supplies on the counter, and our other patient on the other side can have different big setups. So she's got a more complicated IV setup over there, I can see. I also see that she's got some supplies set up, maybe she's about to have her IV fluids or something like that changed. But we use these rooms a lot. They're very nice, especially if students want to treat more than one patient at a time. So you can just walk across the room rather than walking to an entirely different room.
Let's take a look at a patient. This is Simman 3G, a humanoid robot designed to produce vital signs just like a real person would. He can breathe, his heart will beat, you can even listen to his lungs. His eyes will blink, he might cry, his nose can run, and sometimes he will even drool. He can sweat through his forehead, and his eyes are very special, as they not only open and close, but his pupils will dilate with light. They can also open part way, so you can have him looking kind of sleepy, or maybe even medicated. You can also assess his cardiovascular system, as his heartbeat can be felt by pulses in his wrists, just like a real person, and all over his body. When you push down on his wrists, it really feels like his heart is beating. His chest will also produce electrical signals using these little points, just like a real person would. You can attach him to real equipment to check his EKG or even shock him. While you'll find pulses on his wrists, he has them on his feet. Since he is a full body, you can find them on his feet, his groin, his arms, and his wrists. If you wanted to, you could even take a blood pressure. The great thing about this simulator is that he can make bad vital signs and can be very sick. Not every student might get to see a heart attack while they're working at the hospital, but when they come to Simlab, you bet they will.
Other equipment we have here. Here is a real IV pump, so you can actually hook bags of fluid up to this and actually run them into our patient. He actually seems to have a real IV site set up here. So students can actually use this just like they would on a real person. Aside from inspecting where it's going into him, this is the real deal that we use down at the hospital here. There's also a real head wall, so there are actual gases that come out of this wall. So if we wanted to hook an oxygen mask up to him, or give him just some medical air if we had a ventilator set up. There's also suction set up. So we also see the patient monitor here too. So the patient monitor has all the vital signs, all the numbers that we need to know about this person. So here's how fast his heart's beating, his oxygen level in his body. Here's his respiration, so how fast is he breathing? Is he breathing okay? These are all pretty good numbers. 80 for heart rate, 79, that's pretty good. Oxygen, 98% out of 100, that's pretty darn good too. Respirations, 12, that's pretty good for an adult. It's a little slow, but still pretty good. His blood pressure is a little bit low here though. So there are a few other things we have in this room. There's a phone to be able to call the provider or call out into the hospital. So nurses don't practice alone, and our students operate independently in here, but they're never really alone. They're always a phone call away from help. There's also a call bell, so normally this would go in the patient's hand. So we'd give this to our patient, and if we had to leave him and walk away, he could press this button. And as we walk out here, we will hear the sound play throughout the entire nursing station and in the rest of the center. On the wall over here is also the code blue button. Not something we normally like to press, but let's give it a try.
Code blue, room 2355. Code blue, room 2355.
So that warning's playing all over the center.
Code blue, room 2355. Code
Also part of the simulation lab is the home care apartment. Most healthcare personnel work in the hospital, but some of them work inside of our homes. As you look around, this will seem like a mostly normal apartment, with appliances, furniture, and other home decor. A living room, a kitchenette, and a bedroom and bathroom are inside of the apartment. This apartment is completely staged just as if someone was living inside of it, from the plates on the table to the food inside of the refrigerator. This elaborate staging has a very important purpose for this space. Home health nurses and paramedics work inside of the home for most of their jobs. These students will learn to assess the home and see how it affects the health of their patients. They learn to be vigilant to the dangers to themselves and their patients inside of a home, and most importantly, they learn to practice treating patients inside of this environment. This concludes the virtual tour of Pennsylvania College of Health Sciences Simulation Labs. We hope you've enjoyed yourself, and we hope you'll come by and see us in person.